Medical tourism already showing signs of becoming a promising niche market for the country.
And Public Hospitals Authority Chairman Frank Smith says even ahead of the opening of the Princess Margaret Hospital's new critical care block, inquiries from abroad are already coming in as more and more people are beginning to show interest in seeking health care here in the
Shanique Miller tells us more.
It's the single largest investment in healthcare in the country. And now there is light at the end of the tunnel for Princess Margaret Hospital's multi-million-dollar critical care block. PHA Chairman Frank Smith says the work to make it ready is winding down.
The physical construction of the new critical care block at the Princess Margaret Hospital nears completion at a cost of $88 million, and efforts continue to secure staffing and develop existing staff capabilities, acquire equipment, and we are seeking to do so at a quick but sure pace.
The critical care block with its suites of operating theaters and ICU is just the beginning of an initiative that began 3 years ago to modernize healthcare services here in the Bahamas. Even while the 4-story complex is being completed, work is now starting on another area to make available much-needed space and, as Senator Smith pointed out, reduce the tedious waiting time at the state-run hospital.
We've already seen the relocation of core services, like laboratory services, to the critical care block, which have resulted in more physical space in the original sections of the old Princess Margaret Hospital. This space will be repurposed to address existing overcrowding challenges in clinical areas like accident and emergency and the trauma room. We can only imagine the positive impact this will have on reducing waiting times and increasing patient satisfaction in these critical areas. Madam President, once this is completed, it is expected that this major healthcare investment will reap multiple benefits, including improved access to critical care beds for adults and babies, reduced waiting times for surgical interventions, improved surgical outcomes, improved quality of care through the use of modern medical and information technologies, including telemedicine, enhanced diagnostic capacity in a modern laboratory environment.
Already, you've heard the government's plans to partner with the University of Miami and bring its stem cell research program here. The government has made no secret of the potential boost stem cell can bring to the economy. Inquiries and interests have started coming in from other countries as well. Ahead of any launch, the Public Hospitals Authority is equipping locals in the industry so they can benefit. As he made his contribution to the mid-year budget, Smith talked about how that's being done.
The government has organized and encouraged extensive consultative meetings with a broad spectrum of relevant stakeholders across the Commonwealth of the Bahamas. The Medical Advisors Office of the PHA has been involved in the development of the Stem Cell Act, which passed in Parliament and now is awaiting approval of the regulations by Cabinet. And there's a draft MOU, which is with the Ministry of Health and with the PHA to allow for training of Bahamians and an exchange of expertise.
Though he did not provide an opening date for the critical care block, Smith says with enhanced facilities and offerings, medical tourism in the Bahamas is set to explode. Shanique Miller, ZNS Network News.